Now we get to talk about two imaging types of procedures. Now these two imaging procedures are completely different. Now why we're discussing them together is, first of all, they are imaging procedures. Secondly, the way they are spelled, it looks kind of like similar, okay, although different spelling, but the spelling is kind of like, you know, just some few letters different. So sometimes students tend to, you know, misunderstand them and the rest of them. So we want to just discuss the two of them together. So we'll get to talk about what arthrography. We'll also talk about angiography. Okay. So what is arthro? Anytime you hear anything arthro, it has to do with the joints. So arthrography just have to do it. I'm trying to image the joint. Okay. So this is shoulder joint. We have different joints in the body. You have the knee joint, you have the hip joint, a lot of joints. So any imaging in any what joints in the body is arthrography. Okay, so it's just an imaging technique to what evaluate joints such as all those knee, shoulders, hip, and wrist. Okay, so usually they give what a contrast medium. So a contrast medium is like a liquid that when it comes in, it will enhance the image so that I'm able to see all those structures better, and I'm able to see if there's any disorganization and be able to make accurate diagnosis. So purpose is to dictate all those tears in the ligaments of the joint, tears in the tendons of the joint, tears in the cartilage of the joint, access how the you know joint is also still stable and the rest of it. So different imaging modalities that they use for the joint imaging include all those X-ray, fluoroscopy. They usually combine with CT, arthrography. They can also use what the magnetic resonance imaging, arthrography. So patient consideration is make sure that everything is neat, because you are trying to put what contrast in the joint of the patient most at times. So you don't want to introduce infections or bleedings after infections. You don't want infections to come in, bleeding after the procedure. Okay, so that's what we got. So at angio, anytime you hear angio, the first time I heard the word angio was when I was reading about cancer in biochemistry when I was in junior medical school. So they spoke about one characteristic of cancer as what angiogenesis. That cancer cells, they usually make it that extra blood cells will be growing just to supply blood. So anytime you hear angio, it has to do with blood vessels. So angiography, I'm simply trying to visualize the blood vessels. Okay, so it's just a study of what blood vessels. You know, so contrast medium is usually injected in a vascular system. That's a particular blood vessels. You can see that this one is for the brain. Okay, so because blood vessels are so tiny, you are now trying to inject something that will improve the imaging. Okay, so purpose, you dictate all those blockages, all those stenosis, aneurysms, malformations, you know, and evaluate how blood is flowing in some particular organs, you know. So you can also use X-ray fluoroscopy, CT angiography, MR angiography. So make sure that what you are monitoring vital signs during the procedure, and always watch out for any complications that will come as a result of, you know, catheter use.